Good afternoon. This is Erin with the Department of Medicaid. It's not quite 3 o'clock, and we're still waiting on the waiting room to clear and a few more TAC members to log in. So we'll give it just a few more minutes before we get started.
I was trying to get into the wrong Zoom link. I had three of them on my calendar.
Good afternoon.
And everything, Anyway, my apologies, everybody. Oh,
No worries. This is Erin with the Department of Medicaid. Lisa, have you, Eva, and Jennifer logged in? Did I miss anyone?
I'm not seeing anybody else.
Okay. That does give you a quorum that's 3 out of 5, and the
Okay,
waiting room is clear. So we
righty.
were just clear in the waiting room waiting on you. So I'll
Okay.
turn it over to you.
Okay, great. Thank you so much. Uh, Good afternoon, everybody. Welcome to the Nursing TAC for December 5th. It's wonderful to see all of you. Thank you for taking the time to join us. I'm glad we have a quorum today. Have you had an opportunity to look at the minutes from August 15th? Yes, Jennifer? Maybe she got pulled away.
We also need to approve the May minutes. You did not have a quorum last meeting.
Oh, okay. I didn't have it on the, okay. So Jennifer, are you there? Okay. So we'll come back to that if we see her come off of mute, okay? Because I know that me and Eva aren't allowed to do that all by ourselves. Although I think we probably could. We're the frequent flyers on these calls. So um, old business, was there any follow-up from the August 15th MCO reports? Anything out there for the team? No? I'll take that as a no. Okay. Is there any follow-up on the pediatric eye benefits? We spent some time on that. at our last meeting. Is there any follow-ups? Were you expecting any follow-up information, Dr. Stone?
No.
No. Okay. Anything from the group? Okay. With that said, we're moving right along rapidly. We will talk about any news from the Anthem transition.
I am scrolling to see who is on, who might be able to talk. Oh, there you go. Thank you, Jeremy.
Hi, Jeremy.
Hey, good afternoon. So my name is Jeremy Armstrong Dorosset, and I'm one of the assistant directors for the Division of Health Plan Oversight. And part of my role is ensuring there's oversight and compliance to these MCO contracts. So I can update you all as far as the news regarding Anthem transition, which I hope you all have received a communication from the department uh, indicating that Anthem will be transitioning out of our managed care organization effective 1/1 of 2025. And so what that means is approximately 158,000 Anthem members were evenly split between two MCO partners. They will be transitioning to those new MCO partners with that effective date 1/1 of 2025. And we try to do that as an even split to our MCO partners who have the lowest enrollment population. And so those two MCOs that are receiving those new Anthem transition members are United Healthcare Community Plan and Humana Healthy Horizons. And what that will look like for our members, of course, we still have no open enrollment for Kentucky Medicaid. So a member can still come in and request an MCO change if that member does not wish to remain with those two MCOs that's been selected. So if a member comes in today and says, we don't want Humana 1/1, we want WellCare, we allow that. We'll make that effective as long as that request made by the member is prior to the cutoff point. When it comes to our nursing facility, so I think this is important for your all's knowledge around the payment of reimbursement of responsibility for the payer, in which we have instructed our Anthem partner that up until December 31st, they may still have Anthem members. So just because they're transitioning does not mean that Anthem is not a contracted vendor until December 31st of 2024 this year. So a member could essentially still receive and obtain that Anthem membership under that plan up until that point. And what really drives the nursing facility services is an inpatient admission. So really, if a member is admitted, say December 31st of 2024, we're going to require Anthem to remain the responsible payer until fully that member has discharged. And then once that member has discharged, that's when you'll see that transition of that member changing to a different MCO.
Gotcha.
Dr. Stone, I see you nodding. I hope that provides some support, some security as far as the department's expectation for who would be responsible payer, definitely for an inpatient admission that occurs prior or on that same date of December 31st.
Yes, that's excellent. Thank you. Thank you.
Yeah. And then hopefully you all are aware too of our DMS website for a specific landing page for the Kentucky Anthem transition. There's a lot of information
Oh.
published there as a resource for providers and members. We have a frequently asked questions document that is a living document that is updated frequently as we continue to manage the members transition through this, ensuring that really the utmost importance through this transition is member access. Members should be able to continue to receive and access Medicaid covered benefits through this transition.
Okay.
So really emphasizing to not only our providers, but to our MCO partners who are receiving these new memberships, ensuring that the member at most is being taken care of. Do not create any barriers for access to care. because that member's transitioned to that MCO plan. We also have any current treatment plans, whether that is with mental health, SUD, dental, any of those treatment plans that have been priorly approved through a prior authorization process that would go beyond a treatment plan of 1/1/2025. What we are in process of doing, what we actually have in play now, is a prior authorization exchange between MCO partners. So this happens, pretty regularly when members choose to move from one MCO to another. Understandably, there could be services that have been approved by one MCO. And so that expectation with that PA exchange process is for the one MCO to share what that PA approval was, and for that new MCO to honor that PA approval and continue through that treatment plan. If you don't have the link to the DMS website for that transition page itself, I'll be happy to put that in the chat, so that way everyone has access to it. But definitely, if there are any questions that this group has relating to that Anthem transition, just know you can always reach out to myself for any questions, as I will always be happy to assist and answer.
Thank you.
Yeah,
Thank
no
you.
problem.
Very
Yeah, that was great.
Are there, yeah, and I understand too, there may not be any questions readily right now,
Yeah.
but if you all do have any right now, I'll be happy to try to answer any of those.
As happens whenever there's a change. And are you getting preliminary feedback from the people who are going to be transitioned? Are people panicking on you all?
We've been monitoring call centers. So we're monitoring our DCBS call centers. We're monitoring the Connect call centers. We're even monitoring the MCO level. So Anthem, Humana, and United Healthcare, monitoring their call centers as well. We meet probably 3 to 4 times a week. We will meet twice in a week for internal DMS discussions. Then we'll meet with Anthem to discuss about their transition, because there are some specific reports, specific information about PCP lock-in data, pharmacy lock-in data, care management. We want to make sure that the members' transition of care management really comes over to that new MCO. So that way, that new MCO can kind of view that and build that care management to appropriately meet that member's needs. We are continuously, like I said, meeting with our MCO partners as we are going through this transition. Literally weeks away now at this point. But I really do feel confident as far as how we've been able to monitor, engage, and partner with all 3 of those MCOs to ensure that there is the willingness to share information, to share communications, because there could be also a difference between what's being offered for a value-added benefit under one plan that may be a little different under a new MCO plan. So really trying to compare those tools and resources that are there for those members to try to really ensure that they're going to be able to continue to receive those. And then also Anthem is just because they're going away as a managed care organization partner for our state. I do also want the nursing facility to understand too, there is going to be a claim run out. A provider essentially does have 365 days to bill for services rendered December 31st, 2024, all the way till December 31st of 2025. However, we, the department, are really emphasizing to our providers, get your claims into those to Anthem. If they're billed to Anthem, get those claims into the Anthem as soon as possible. Because there's also appeal rights a provider has that should be afforded to you and will be afforded to you at each level.
Okay.
So I don't want to give too much information, but if there are any specific questions.
No, that's awesome. That's really good information. Thank you. And if you don't care to drop that link in the chat, I'd appreciate it.
Yeah, looks like, yes, it looks like Jeff Chapman already did that with.
Oh, perfect. Thank you.
Thank you. Can everybody see
I don't
that
see
message?
that. Okay. For some reason, I don't see that in
Oh,
my chat.
Directly to
I'll
you.
get it. It was sent
Yeah,
directly to me. That's
there you go.
Oh, okay.
he's assisting me. Thank you,
I'm
Jeff.
like-
I appreciate that.
Hey,
Show the group now.
Yes, to everyone. Okay, I see it now to everyone.
I do
Yep.
too.
Thank
Okay,
you.
perfect, perfect. Again, we've got a lot of information published out there. So even if you're not readily know of a question, you may look at that documentation and it may pique a question. So just know you have my support at the department's level to come and engage with about this transition.
Perfect.
Thank you. Yeah.
All right. Thank you all.
Even any other questions on that topic? Are you good?
Yep, for me, I'm good.
Okay,
You guys are
Jen-
good.
Jennifer, were you able to get active? I'm just backstepping here just a sec. Okay, so we'll keep moving forward then. All the MCOs in Kentucky, do they collaborate with the ACOs currently listed on the CMS website for the state? And then, we proceed to list a few here. Do any of the MCOs in Kentucky partner with ACOs outside of these organizations?
And Lisa, if I could backpedal just a little on that, to the bullet before that, does DMS track ACOs in Kentucky? Is there any,
Oh, I'm so sorry, I missed that.
No, don't apologize. It's okay. Do the ACO are measures reported to the cabinet?
Hi, this is Angie Parker. ACOs are Medicare savings programs.
Uh-huh.
So I'm not really sure that we would be
Okay.
tracking those.
Yes, this is Jeff at Molina. It's kind of a loaded question. So there, to my
Well,
knowledge,
it's an ignorantly asked loaded question, so
Not enough,
forgive
but
me
you
on
can say
that from the gate.
yeah, alternative payment models vary. ACOs being the most extreme at one end of it, where it's complete assignment. So they're capitated by a payer or Medicare, for example, upside downside risk. So essentially an ACO is its own MCO.
Gotcha.
Molina,
Okay.
yeah, Molina does not have any ACO models. We do have a number of different alternative payment models. And we do share all that information with DMS. So we report all of our value-based agreements and contracts to them.
Okay.
And yeah, we work very closely with the different hospital systems and provider groups to make sure that they are appropriate for the number of members they serve and what types of services they offer.
Okay.
But yes, we do have, I think just about everything listed there. We have some sort of arrangement in place with them for quality of care enhancements or incentives, I should say.
So are there, I guess, just trying to understand, so as nurses, nurse practitioners across the state, with their work in Medicaid billing, I ask this question from the framework of nurses who are involved in school-based billing in particular, but the more I looked into it, the more the water is muddy, which thus the questions for the group, because there are a lot of entities out there, it looks like, that are looking at value-based models and or working with value-based models. So there's a lot of that work happening. And I just really am curious as to what is happening with school-based Medicaid and quality groups who are ideal partners. So go ahead with what you were saying.
So the clinics that are based in a school, whether they be operated by a school or by a larger provider group, would still be eligible for some sort of value-based deal. It depends on their willingness to do it. I would say those typically would be incentives associated to preventative care measures, but it could be anything and everything. I know we've worked with a couple of different provider groups that have school-based clinics. And it just kind of wrapped up at the group level. So it doesn't matter where the child or the family goes, they would get credit and some sort of incentive payment for wherever it's rendered.
Okay.
Okay. Anything else on that topic before we move on? So then to
So-
the next, oh,
Okay, so if I can just ask, so Angie, you had mentioned that they're primarily used with Medicare.
Yeah.
What I've read, it led me to understand that there were opportunities with Medicaid as well. So if I've misunderstood that, just shut me up. I guess.
Kind of what Jeff was talking about. It's mostly, you see ACOs, which are quality, I mean, a group of physicians or groups that are required to meet certain quality metrics.
Okay.
So, I do know the MCOs do have value-based contracts with some providers, which could
Okay.
be considered
Gotcha.
something like that. You typically don't see an ACO with Medicaid, but I could definitely be wrong, Dr. Stone. So,
Yeah.
but it's more gauged with the Medicare Shared Savings Program to get additional funds for quality measure for obtaining
Mm.
quality measures.
And Dr.
Okay.
Stone, this is Stuart on with WellCare. Both Jeff and Angie, I think, did an excellent job. And I actually looked, are there any Medicaid ACOs in Kentucky? And there's a Kaiser Family Foundation website that through 2023 shows 0 in Kentucky that are Medicaid ACOs. I don't know if any been added in 2024, but and when I talked to staff here, they said that's Medicare, not Medicaid, when I asked them about ACOs. So I'm thinking there aren't any in Kentucky.
Gotcha.
Yeah, full-fledged ACOs are a lot of work. It's a lot of reporting and it's a lot of risk, to be honest with you.
Okay.
And it's administratively difficult for both the provider and an MCO a lot of times. So I've seen them happen before in other states, and I've seen them go very well and very poorly.
Okay.
Medicaid is a little difficult because the population can vary so much, and you really have to have a large risk pool in order to enter into an ACO model because you're absorbing risk on the cost of care of those members. So
Okay.
it's a challenge. So I think in Medicaid, the value-based contracts in place for different quality measures that align typically with HEDIS and some behavioral health measures are usually the way that the MCOs, especially Molina for sure, will go. So that's as close as we would get to an ACO in the state of Kentucky right now. The future could change. We would certainly have to work very closely with DMS though if we did that.
I gotcha. Okay. But okay. I just have to think. I have to digest what you all have shared just to think through in my mind as far as the work in Kentucky. I'm even going to go back to some of the things that have been presented to the TAC at earlier meetings. Lisa, we had talked about maternal child health and reimbursement to nurse practitioners for maternal. And so, we're a state with very poor maternal child health outcomes. With disparities in our maternal child health comes, I guess I just want to put it that way. And so when we look at some of these issues that are directly related to nursing care, whether it's in schools or in other settings, how much emphasis are we placing on quality care really is the root cause for my questions, these questions.
meaning the disparity, there's not enough
Well, not just the
licensed
disparity, but in the cost.
in the cost and the disparity because there's not enough physicians.
Because there's not incentives, I guess because we're not incentivizing care on the front end. And so if we look specifically at school-based care, we have incredible opportunity for collaboration between MCOs and school districts, for example, to be leveraging some things that could help reduce cost for the care overall, but also improve outcomes.
Well,
And
improve
so,
the amount of care that's available,
absolutely. And so,
thereby improving outcomes.
yeah. And
Right.
so I would apply it to any setting where we're delivering care, particularly in those populations that where there are absolute disparities. I mean, the Kentucky leads the country for poor health outcomes. I mean, we've made some progress in some places, but we're still a state where I'm just wondering if I'm trying to learn more. I think our nursing TAC is a group that can really have more discussions about this and about the care that's being provided and how.
Well, and to that point, we have made presentations to the MAC on 2 separate occasions, and we're told not at this time.
Absolutely, yes, yeah.
That's, yeah. Doesn't mean we can't go at it again. It's a new year.
Almost there.
And we don't give up. So, okay.
So there is work happening in other states too. So it would bear us just.
Well, we can look to them as an example of,
Yep.
A change being successful.
Yep.
More to come.
Yeah.
I'd
So
love
that was the basis. I don't have any more questions. That was just kind of the basis for this conversation. And
I got you.
some
Okay. All right. All right. Good dialogue. And you all are very helpful.
Yes,
Your
thank you.
information. We really appreciate your openness, your transparency. You know your material, and it's appreciated. Where are we, Erin? Because we did kind of like talk through things.
The minutes. We've got to go back to the minutes.
Okay,
I
Jennifer.
sent the person logged in as Jennifer asking to make sure it's, our Jennifer, and we're not calling on someone who's another Jennifer, and I didn't get a response. So,
So we were excited to have a quorum, but we don't.
that's what I'm thinking. I do apologize. We can
It's
go
okay.
over the meeting dates for next year. But Eva, I was going to mention, because you said other states and things, we have had other TACs who have had a contact with other states who have invited them to the meeting to present things that are
Okay.
working in their state. So I did want to let you know if the chair is okay with that. We have had other states who have said, hey, I'm on a work group with this person in another state, and they wouldn't mind to come and talk to us about A, B, and C that they're doing that work. So I just
Eva,
wanted to
that's a
mention
great
that.
opportunity. Thank you.
Yeah.
That's a great opportunity.
I appreciate that.
Because that would, that also helps us learn if we hear how things are being done elsewhere, and that gives that dialogue. So I did want to throw that out there.
Thank you.
Okay. So we went through what we could go through.
We did, and it's 3:28.
I mean, that just doesn't happen with us. I'm just saying, we always run over. Wow. Does anybody have anything they want to talk about or need to bring forward for us? You feel like you need to share? No? You're actually going to get time back. I hope, well, on behalf of the nursing TAC, I hope all of you had a wonderful holiday, Thanksgiving holiday. And I hope that you're looking forward to a wonderful, the rest of your holidays being wonderful. We won't see each other until well into the new year in February. So Eva, I don't think that you and I should try to get together, or at least an email jabber, and try to figure out if we can get us maybe a speaker or
Okay, sounds good.
someone to chat with us from another state. I think that that's a beautiful opportunity for us. And I think we found something that we can kind of lean into for the new year. So anyway, with all that said, Merry Christmas, everybody. Happy holidays. And we wish everybody the best. And thank you for all you do for our community, our patients across the state. It's very appreciated.
Thank you. You all
So-
too.
Thank you very
Thank
much.
you. Have a great
Um,
Take
afternoon.
care,
Oh,
Can I
everyone.
ask a question real quick, Lisa?
Of
So
course.
we can't approve for the meetings for next quarter without a quorum, but we will still have February 20th at our next, as our
We'll
next meeting.
still plan on February 20th. And are we allowed to do anything by email quorum?
You can, so you don't technically have to vote on the meeting dates. We do typically do that. Now, some TACs prefer to do it because that's where everybody's in one place. But we do have an email out. So if you guys just want to respond to that email that you're good with the dates, and we can follow
Okay.
up with the other
So that
members
we
just
can
to
at
make
least
sure
get
they're
that
okay with
done.
it.
Yeah.
Yes, ma'am.
Okay. All right. Perfect. Thank you so much.
Absolutely.
Thanks, everybody.
Okay. Thank you.
You.
Bye-bye.